Hello again, dear viewers, on another episode of Doc Talks, where we continue the subject of broken heart syndrome with our dear guest, Dr. Sundos Alhadhoud. We will continue to bust some more myths about the condition, set some facts, and clear the air about certain things. Stay tuned with our guest, and we will talk some more. Welcome again, dear viewers. We have a special segment in our episode, a very interesting one, where we're going to talk about some myths about the condition, and we will have our guest bust those myths and tell us the actual true facts about it. Dr. Sundos, hello again.
Hi, Abdulaziz, and thank you for having me again to highlight the important facts regarding takotsubo syndrome or broken heart syndrome.
Absolutely, and it's always a pleasure having you on our show.
Thank you.
Let me start with one myth here and tell me if it is an actual myth and what is the true fact or the counterpart of that myth, so to speak. Now, based on what I know, takotsubo syndrome, or also known as broken heart syndrome,
Yes.
only appears after a strong emotional shock. Is that a myth?
It's correct, but it accounts, as we said in our previous episode, for
Yes.
20% of the cases. 80% of the cases actually are physical stress. And when we talk about emotional stress, it's not only the negative one, but also the positive one.
So it's predominantly about physical shocks, not emotional shocks.
Exactly.
For this condition. Now, another myth here I have with me is that takotsubo syndrome affects only emotional women.
No.
Bit of a specific myth here.
Men actually can have it, as we
Yes,
said, but the numbers are less compared to women, and we're talking about the postmenopausal woman. But the severity of takotsubo is more with men. And regarding statistics and studies, why is it that happening? Because unfortunately, doctors, they don't pay much attention to men when they come and they state that they are under a lot of stress and they have this pain, shortness of breath. They will say that this is an anxiety attack, and they will just remove the diagnosis of takotsubo from their mind. That's why they come later on with the complication of the disease itself.
Also, doctor, we're men. We love to be macho and kind of shrug it off, like, oh, I'm fine. I don't need this. I don't need
Exactly.
that. Another myth I have here is that broken heart syndrome only affects the elderly, like 50 years and older.
More common in the elderly,
Okay.
but sometimes it can happen. Actually, we have seen some reported cases in teenagers and in people in their 20s and 30s. And that's because, as we said, physical stress and its effect on the body plays a role. So if there is road traffic accidents, a major trauma, major surgery, hemorrhage, a severe asthma attack, all of these will lead. People who are young, also they experience feelings and emotions. So definitely teenagers, especially when there is surge of hormones and the imbalance of the hormones and they don't know how to react to it. Sometimes, yes, there are cases. Have I seen any? No, but it has been reported.
Now, let me play devil's advocate here for a minute. You were talking about menopausal women. You kind of hinted at it.
Yeah.
Is it safe to say that menopausal women who, based on our previous talks, who are depleting their estrogen are far more prone to having broken heart syndrome than healthy, men who suffer from it or teenagers?
Exactly. And the reason is that women after they stop their period, when they reach menopause, the estrogen is actually the protective factor. It usually protects the heart and the vessels of the body. Once it is stopped producing, then their bodies are exactly like men. The problem is they are still emotional. So emotions plays a major role in, as we said, the connection or communication between the brain and the rest of the body. And one of them is the heart. So they are more prone to have the neurohormones or receptors to be more secreted because they still have their emotions.
Correct. Now, another myth, there's no treatment for broken heart syndrome. You just wait for it to resolve, kind of like a cut on your knee. Is that correct?
Exactly. Definitely. No definitive treatment because there is no underlying cause. It's only that there are hormones that has been secreted constriction that happened for a period of time, then reopened. So you can give treatment for the symptoms or for the complication of the heart, but you cannot treat it itself. So if there is a heart failure, you give diuretics. You can give angiotensin converting enzyme inhibitor or ACE inhibitors, as they call them, angiotensin receptor peptide blocker, or ARBs. So these medications help to improve the function of the heart, reduce the blood pressure, so reduces the load on the heart, and until the heart recovers, which will take, as we said, weeks to months.
Now, doctor, as we were talking earlier, somebody gets, broken heart syndrome is usually due to physical trauma that manifests later on to emotional trauma, correct?
Exactly, yeah.
Now, if let's say somebody in some certain, very difficult circumstances, and they don't know it's broken heart syndrome, but they just know that their peer or their guardian, their parent is extremely sad and due to whatever accident, physical accident that they've had. Could it possible that their attempts at making them happy and kind of bombarding them with positive emotions reverse the effects of that syndrome?
Definitely. Maintaining emotional and psychological health is very important in fastening the time for recovery. It's very important. And you know that during the pandemic, COVID-19 pandemic, there are a lot of takotsubo cases or reports there, and some of them says that it's because related to the virus, while other studies shows that because many of us have lost a dear friend or family member or a spouse or a child or a parent in the pandemic, so more prone to have, as you said, negative emotions. That's why the incidents are more. But definitely psychological and mental health is very important.
Doctor, unfortunately, this segment specifically has come to an end. I am still extremely greedy in getting more information out of you. Please stay with us. We will go to some messages and we will be back. Dear viewers, don't change the channel just yet. Please stay tuned as we come back after these messages. Welcome back again, dear viewers. We continue our episode with our guest, Dr. Sundos Alhadhoud, and we talk about a very important topic, and that is diagnosis. Hello again, doctor.
Hello, Abdulaziz, and thank you for having me again for the second time to talk about the interesting topic and interesting syndrome.
Definitely, doctor. Now, Dr. Sundos, can you tell me how can we tell the difference between takotsubo syndrome and a real, actual heart attack, especially since the symptoms are extremely similar?
Definitely, and this is the trick regarding the diagnosis. It's usually you cannot know until you do the full investigation, and that's why it takes a few days for a person to have the diagnosis. And this person who's suspected to have acute coronary syndrome, this is what we call it. So it includes all the coronary problems that a person might have, or coronary artery disease. So usually the person is admitted to the hospital, and then at that time, all the investigation should be done. So first of all, history, medical history. Did you have any stress event in your life recently? Any grieving? Any happy news?
Extremely happy news.
Because you'll be surprised that people, let's say a woman who has been waiting for a proposal after many years of waiting, and then suddenly she will have it. Many reports actually of takotsubo in those women. So you will be surprised for also the positive emotions, not only the negative emotions. So medical history can give us a clue on or direct us where to go in the investigation and diagnosis. Second of all, there is the physical examination. We examine, we hear any heart sounds, abnormal heart sounds, we hear any fluid accumulation in the lungs, we check for all the systems and organs. And then we come to the lab results. Labs are very important and usually cannot differentiate between takotsubo and acute coronary heart attack or myocardial attack.
So even a very specific blood test could actually be tricked by the symptoms or
exactly.
whatever results come out of it?
Exactly. It's sensitive,
okay,
but not specific. What do we mean by that? Sensitive, it picks up that there is a problem in the coronary arteries and in the heart muscles, but it's not specific. It doesn't tell you where to exactly look for. So we said in takotsubo, usually there is a temporary constriction of the coronary arteries, and then it will reopen again. While in myocardial infarction or heart attack, the constriction is actually there. It's not going. It doesn't open. So those enzymes, what we call troponin, actually they are secreted whenever there is even a scratch in the myocardium or the heart muscles. So it's sensitive but not specific. That's where we have to do echo, and sometimes we will need cardiac catheterization, which can be replaced now by CT angio and cardiac MRI.
So you'd follow these tests specifically into actually confirming whether it's, you know, broken heart syndrome or a heart attack.
Exactly, because the problem in when you're doing echo, even if you reach that level, a myocardial infarction actually have the same effect on the heart as the takotsubo. But as we said, there is sometimes the traditional takotsubo where there is the ballooning, but also a myocardial infarction of some of the coronary arteries at that specific area will sometimes it leads to the same ballooning. That's why it's better to do the coronary angio through cardiac catheterization, where we put a dye, and it's usually going through the artery in your wrist.
Yes.
And then they will put a dye and see if there is a constriction thrombus or not. And this is where you differentiate between takotsubo and myocardial infarction. Takotsubo will be normal.
Okay. Now let me get a little bit specific. You're saying that when that dye reaches the arteries, it could potentially, you know, due to the blockage, somebody could be confused whether it's a heart attack or broken heart syndrome. Is that correct?
No, this is where you differentiate between takotsubo and myocardial infarction. Myocardial infarction, you will not see the continuation of the dye or the artery itself. There will be blockage. But in takotsubo, it's a normal artery, so the flow will be normal. And this is how we differentiate. Now, CT angio is where also the same thing. They will put a dye also in your wrist, and then they will take computed tomography or CT of the heart, thin slices. It will take only 5 to 7 minutes, but then at that time, you can also see the coronary artery, and you will know that if there is a blockage or not. If no blockage, then this is takotsubo. If there's a blockage, then this is myocardial infarction.
Definitely, doctor. Now, again, unfortunately, we're going to have to take a little small break and continue our interesting conversation.
Definitely.
Dear viewers, we will take a small break and check out this report, Healing on a Plate, and we'll be back with Dr. Sundos Alhadhoud. Stay tuned. Welcome back, dear viewers. We will be continuing this useful, interesting, and very helpful conversation about broken heart syndrome. Hello again, doctor.
Hello, Abdulaziz, and thank you again for having me.
Now, doctor, I wanted to know, we were talking about a lot of tests. I want to get a little bit more specific. I'm trying to get as much as I can out of you.
Definitely.
Is there a role for cardiac MRI in investigating or visualizing takotsubo, and when is it usually performed?
You remember in our last episode when I talked about my colleague and that we did for her cardiac MRI?
Yes.
Actually, cardiac MRI is very beautiful. You can see the motion of the heart, and you can do 3D reconstruction of the heart. You can see the heart as if it's in front of you. So in MRI, we actually see the muscles of the heart, and sometimes we can do MRA, where we put a dye, the same thing as we do in catheterization and CT, and we see the uptake of the dye in the muscles of the heart. So you will know that this muscle has been affected when there will be no dye uptake, but the other healthy muscles of the heart will be very bright in MRA, what we call MRA, which is MR angio.
Okay.
So the same thing, and it can give you the anatomy of the coronary arteries. It can give you the anatomy of the valves, because if the blood supply of that valve or the muscle of the valve is affected, then there will be tear of the muscle of the valve, where you can see it floating. And this is very dangerous.
It's going to like leak into the rest of the body.
Exactly. So every time you want to close the door, The door is
Right.
not closing. So they will be, as you said, leaking of blood, and then it will lead to congestive cardiac failure. So doing MRA and MRI is very important. And we have forgotten about a very simple test that can be done in the emergency room, which is the ECG, or EKG in the American language. The ECG is electrocardiogram, where we see the rhythm of the heart. So we can diagnose any arrhythmias, and we can diagnose any dilatation in one of the chambers. It will give us indirect way of knowing. But the problem is, in the acute phase, it resembles myocardial infarction. So you cannot differentiate which is which.
Absolutely. Now you're talking about the rhythm of the heart.
Yes.
You know, an idea might occur to somebody that this condition can be confused with another condition due to the similarity of the abnormalities in the heart rhythm. For example,
Exactly.
like let's say somebody who has a leaking valve.
Yes.
Excuse my very simple terminology here. Or maybe broken heart syndrome, and we do an EKG or an ECG on both of them, and we find out that the abnormalities in the heart rhythm are very similar. Now we're in a situation like, what does this patient have? Is that possible to happen?
Definitely, and that's why I told you diagnosing takotsubo is really tricky. And even though that the diagnosis or the syndrome have been named in 1990, but it is there from the beginning of time. But the problem, people, they didn't put it in mind because they never knew that there is a relation between stress and the heart itself. But the symptoms, you cannot say definitely that this is a takotsubo or other coronary artery disease unless you perform, as we said, coronary catheterization, CT, angio, or MRA, in order for you to put the dye and see the anatomy. But if you rely only on the let's say primary investigations, lab and ECG, you will not get a diagnosis. But what will give you a hint is the history. So there will be a history of stress, or a stressful physical event, or stressful emotional event.
I wanted to get your opinion on certain studies. These studies suggest that in order to get a very accurate diagnosis on the condition, one must practice exclusion. For example, performing certain tests so they can exclude certain conditions.
Definitely.
Until they narrow it down to takotsubo syndrome, broken heart syndrome. What do you think about that?
Definitely. And why they do that? Because there are certain conditions, like myocardial infarction is a life-threatening condition. You have a few hours to act and treat, and then in order to preserve the function of the heart. That's why it's very crucial, and usually it's an emergency case. So you do all the investigation, and then when you do the cardiac catheterization, where you see the anatomy of the coronary arteries and it is normal, then at this time you can say, okay, I'll stop everything and I'll just continue the management, and I can send the patient home the next day, 1 or 2 days.
Definitely, doctor. Again, we're here, trying to get as much as we can out of you, benefit the viewer, make sure they know the differences of the conditions or the symptoms that they're, suffering from. But please stay with us. We will definitely continue this useful conversation. Dear viewers, we are not at the end of our episode. However, we need to take a break, and we will definitely be back with Dr. Sundos Alhadhoud. Please stay tuned. Welcome back, dear viewers. We are at another segment where we're going to talk about treatment and follow-ups. Dr. Sundos, hello again.
Hello, Abdulaziz.
After we've understood, the accurate diagnosis of takotsubo syndrome, would you say that the treatment is similar to that of a heart attack, or what could potentially be the differences?
The difference is that your coronaries are normal. So you just now give your heart time to recover. So in simple cases where there is no heart failure, where there is no thrombus, where there is no abnormality to the valve, you don't do anything. We just repeat the echoes every 4 to 6 weeks, and then wait for the heart to go back to normal. And usually this takes few weeks to few months. Now we come to the complex case where we have a thrombus. Then definitely we will require some, let's say, liquidifying medications like aspirin, sometimes warfarin, sometimes...
Thinning of the blood type thing?
Exactly. So they make it thinner and more liquid in order to prevent thrombus formation. So sometimes it is required. In cases of heart failure, where the muscle is not pumping well, as we had with my colleague, so we had to start some medications that strengthen the heart muscle and also reduce the load and pressure on the heart. And this is where ACE inhibitors come, and angiotensin receptor blocker. If there is arrhythmia, we give some medications to regulate the rhythm, and so on.
Now, doctor, if I wanted to, so far after all that we have discussed, if I wanted to kind of simplify everything in very simple forms, would you say that this condition is as if it was like your biceps that you've overtrained in the gym,
Yes.
and now you need to rest the muscle so it goes back to its normal state and even possibly better?
Exactly. It's exactly the same, because the heart is a muscle. So you need to rest the heart in order for you to regain back its function. Now, people will focus only on the medical side. They always forget about lifestyle. They forget about taking care of your body mentally and physically while you are in the recovery period. So eating healthy diet, exercising regularly. We are not talking about strenuous exercise. We're talking about simple walking.
Possible cardio, simple cardio.
Exactly, but don't overstress yourself. So you can have jogging, walking, swimming, do some meditations, relaxing exercises. All of these are important. Social groups, support a group is very important. You can find them online, you can find them where you go to your doctor. The doctor will advise and give you the support group that are available in your country.
So mental health is a huge part in this.
It's very important and plays a major part in the recovery and preventing relapses, because you can have relapses.
This is a very great, kind of stopping point where we can actually shed some light on mental health. A lot of people might shy out from, seeking mental health. So can you give us an advice or word on that?
First of all, needing a mental guidance and mental treatment and mental therapy is not a stigma. All of us are under a lot of stress. All of us are burnt out from work, from family responsibilities, from many things. So seeking medical advice and help is actually a brave thing to do and the right thing to do. This is the first thing. And all of us go through this. The second thing, stress affects our body in many ways, and from this episode we know that it affects the heart. So it affects the immunity, it affects your sleeping, it affects your growth, it affects your appetite. So it has many let's say impact on our body, so we have to deal with it. Third, sometimes we might require some medications in preventing and management of takotsubo, because we're talking about takotsubo per se. So some antipsychotic medications are required: antidepressant, antipsychotic, anti-anxiety. All of those are very important in order for to help us in the recovery and to prevent relapse. Relapse can happen, as I said before, and sometimes it's not as simple as you get it. Sometimes it is more severe. So that's why just take care of your body.
Absolutely. Now, I know from what I understood from you that this condition it comes in levels, right? It could be as extremely severe, it could be, mild, it could be very light. In what cases a patient has to be admitted into the ICU?
If there is congestive heart failure. What do you mean by congestive heart failure? That the heart is not pumping, it's stunned. And there is fluid accumulation and blood accumulation, so it will affect all the fluid in the body. So in order to prevent multi-organ system failure, we need to admit that patient to the ICU, restrict the fluid intake, give some diuretics, which are medications that help to get rid of the excess fluid from our bodies. Sometimes there are some inotropic medications. Their mode of action is that they strengthen the muscle. They force the heart to pump in order to get rid of the extra fluid and extra blood from the body. So that's why sometimes the ICU is required.
Now, if that condition is not as severe to be admitted to the ICU, is the cardiac ward enough to treat it on the spot?
Definitely. Sometimes we can send them home after 1 or 2 days. No need for them to be admitted. But this is where you should be in charge, not the doctor. The doctor will give some instructions and follow up. But you, the affected person, is in charge. You take care of your mental health, your physical health, eat healthy, exercise, stop bad habits, smoking, taking illegal drugs, drinking, all of these needs to be stopped. Unhealthy diet full of saturated fats, processed meat, all of these are lethal to your body. So it's better to stop them and go back to regular, normal, healthy diet.
So it's just like really a bunch of elements that are piling up on themselves, where they could potentially lead to, broken heart syndrome.
Exactly.
Or it could just worsen it, for that matter.
Exactly.
Now, doctor, do all takotsubo cases need medication that support the heart muscle, like beta blockers or ACE inhibitors, or are there, like we said, cases where it's just antidepressants or simple aspirin could, do the trick?
This is what I said. Actually, not all medications. It depends from one patient to other. So if there is heart failure, then we will give angiotensin receptor blocker or ACE inhibitors. If there is excessive fluid in the body or pleural effusion, then we will give diuretics. We will give some inotropes to improve it. So it depends where is the problem exactly. Now, we talked about the causes, the stress, physical and emotional, but don't forget there are some viruses. So in some studies showed that the number of incidents of takotsubo are actually higher in winter season. And
Wow.
That's because viruses are more in winter season. So viruses play a role. As we said, especially in the pandemic when there was COVID.
Absolutely.
Some said because of the news and loss of a loved one, but some said it's the effect of the virus on the heart itself. So viruses play a role. We said tumors, especially the pheochromocytoma. It's a tumor where it secretes catecholamines, where it secretes adrenaline and noradrenaline. So if a child, a teenager, a grown-up have a pheochromocytoma, then they are more prone to have takotsubo syndrome than compared to normal population. So it depends what the condition the person is having. This needs to be treated in order to prevent the ongoing effects of that condition on the heart.
Doctor, unfortunately, the episode is coming to an end. However, I would like to hear one last possible story or even a word from you to finalize this beautiful and interesting talk.
Abdulaziz, there is a very interesting case report for a 60-year-old woman in 2019 who had takotsubo syndrome after eating wasabi, thinking that it's a cucumber.
Oh, wow.
So the stress on her body actually caused takotsubo. Exactly.
Definitely. Thank you so much for your time, doctor. It was absolutely a pleasure having you.
Thank you so much for having me in the show, and I hope you and the dear viewers benefit from the tips and points that I gave through today's episode.
Definitely, absolutely. Many thanks to Dr. Sundos Alhadhoud for her time and efforts in explaining what takotsubo syndrome is and how to treat it. Thank you so much, doctor. I hope everybody benefited. Please stay tuned in another episode of Doc Talks. Until then.